If you've been told you need a dementia assessment, or you've decided yourself to seek one because something doesn't feel quite right, there is a good chance that you've also been told very little about what that actually involves. I'm Dr. Max Malik, I'm a consultant psychiatrist, and assessing memory and cognition is a significant part of what I do. I want to spend a few minutes explaining what a proper dementia assessment looks like, what it can and can't tell you, and what happens next. Why people come for assessment? Well, most people come to see me because they fall into one of three groups. The first are people who've noticed changes in themselves, such as, for example, struggling to find words, struggling at work, maybe losing track of conversations, and sometimes losing ability to do things they could easily do before. And then that makes them worried. And the second group is family members actually start getting worried about people. It could be a partner or parent, and they just don't know how to raise it. And the third group really is somebody's doctor gets worried, like their GP. And sometimes they've done a short screening GP test, and then they recommend to come and see me for a fuller assessment. So all three of these are valid reasons. You don't need to already have a diagnosis to seek an opinion, and that's what an opinion is for. But what does the assessment involve? Well, a thorough dementia assessment isn't a single test. It's a structured clinical interview combined with cognitive testing, looking at the mood, physical health, the whole person, and then getting neuroimaging and blood investigations if needed to rule out reversible causes, and there are some of those as well. In the consultation itself, I spend a lot of time taking detailed history from you, family, when you started noticing difficulties, what's been affected. We ask about everything you do, like your sleep, mood, alcohol, medication, physical health, your family, etc. And I like to speak to somebody who knows you well as well, because sometimes it's not so easy to say things about yourself, but somebody else might have then noticed things. I also then carry out a structured cognitive examination, and that involves things like memory, attention, language, and executive function, and if needed, we can go into more detail in each one of these areas. A good assessment can usually tell you whether your symptoms are consistent with dementia, or they can tell you sometimes if they're not. And sometimes we look at things like sleep disturbance, physical health like thyroid, vitamin problems like B12, anxiety, and then we need to consider all this before a diagnosis is made. What it can't give you is absolute certainty in every single case, because cognitive changes can be subtle, and sometimes the most honest answer is we may need to see your review again in 6 or 12 months. That's not a failure, the assessment. In fact, it's a part of it, and we can keep that under review until we get to the right answer. If a diagnosis is made, we will talk through what it means, what does the trajectory look like, what pharmacological and non-pharmacological treatments and options and support mechanisms are available for you and your family. If no diagnosis is made, we'll talk through what we've ruled out, what we should continue to monitor, and what's going on the best way still to help you, so you still get an answer, support, and a management plan. That is the point of the assessment. To book a dementia assessment, please get in touch with the Health Suite.